Did you realize that while you're watching this video, dozens of older adults will be told they have dementia? That's about one new case every single minute. Most people assume it's just aging. But what if part of the problem isn't time? It's your medicine cabinet. We've been led to believe that prescription pills and over-the-counter remedies are safe, routine, even essential. But new findings reveal a disturbing truth. The majority of seniors are unknowingly taking at least one medication that may damage memory centers in the brain, sometimes shrinking them by nearly a third in under a year. And here's the shocking part. Pharmaceutical companies have had hints of this for decades, while making billions from drugs that may quietly speed up memory decline. In fact, recent research published in leading neurology journals shows that certain commonly used medications can raise the risk of dementia by nearly 50% in as little as 2 years of use. In this video, we'll uncover 9 widely used medications that may accelerate memory loss, ranking them from the quietly risky to the most alarming. You'll be surprised by number 3. It's a drug prescribed to millions for something minor, yet it may be silently eroding your brain health without you even knowing. But before we dive in, tell me in the comments, what medications do you or your loved ones take daily? Have you ever experienced brain fog or sudden forgetfulness? I'll be reading through your comments and sharing feedback, because this conversation could genuinely protect your mind. All right, let's begin. Number 9. Diphenhydramine, Benadryl, and similar PM or nighttime pills. This pink pill is trusted for sleep, allergies, and colds, but inside the brain it blocks acetylcholine, a chemical critical for forming memories. The older we get, the more we rely on every bit of acetylcholine. Without it, memory and clarity decline rapidly. Studies show seniors regularly taking anticholinergics like diphenhydramine have over a 50% higher chance of developing dementia. Safer alternatives: non-sedating allergy medications such as loratadine, Claritin. Number 8. Proton pump inhibitors, PPIs, Prilosec, Nexium. Designed for heartburn and reflux, PPIs work by reducing stomach acid. But they also block absorption of vitamin B12 and magnesium, nutrients essential for brain function. Long-term PPI use has been linked to higher dementia risk and buildup of amyloid plaques in the brain. Safer choices may include H2 blockers like famotidine, Pepcid, or even natural stomach soothers such as deglycerinated licorice. Number 7. Bladder control medications, oxybutynin, ditropan. These drugs reduce bathroom trips, but at a high cost. They strongly interfere with acetylcholine and cross the blood-brain barrier, directly affecting memory centers. Studies show long-term users have up to 49% greater dementia risk. Fortunately, alternatives such as mirabegron, Myrbetriq are available with less impact on cognition. Number 6. Statins. Simvastatin, atorvastatin. Statins lower cholesterol to protect the heart, but cholesterol is also essential for brain function and nerve communication. Long-term use of certain statins has been tied to memory problems and mild cognitive impairment, especially at high doses. Not all statins have the same effect. Some newer ones are less likely to cross into the brain. Number 5. Benzodiazepines, Xanax, Ativan, Valium. Prescribed for anxiety and sleep, they initially calm the nervous system. But with extended use, they can dull the brain, slow learning, and sharply increase dementia risk, sometimes by more than 50%. Stopping suddenly is dangerous, so tapering under medical supervision is key. Safer approaches include therapy or non-sedating alternatives. Number 4. Amitriptyline, Aleve. This older antidepressant is still prescribed for pain, migraines, and insomnia, but it's one of the strongest anticholinergics in circulation. Long-term use significantly raises dementia risk. Even at low doses, it can erode memory over time. Alternatives like duloxetine, gabapentin, or milder antidepressants may be safer. Number 3. Paroxetine, Paxil. Unlike other SSRIs, Paroxetine also blocks acetylcholine, making it uniquely harmful to memory and attention. Seniors on paroxetine show measurable cognitive decline compared to those on other antidepressants. Experts recommend avoiding it entirely in older adults. Number 2. Antipsychotics, Seroquel, Risperdal, Zyprexa. Once meant for schizophrenia or bipolar disorder, they're now widely prescribed to manage behavior in seniors. The downside? They suppress dopamine, blunt personality, raise stroke risk, and sharply accelerate cognitive decline. In many cases, non-drug approaches work better. Number 1. Polypharmacy with anticholinergics. The most dangerous situation isn't one pill, it's the combination. Taking multiple medications with anticholinergic effects adds up. A sleep aid here, a bladder pill there, maybe an antidepressant too. Together, they more than double dementia risk. The fix? A full medication review. Identifying and reducing unnecessary anticholinergics can restore clarity, sometimes within weeks. Drug-induced dementia is real, but often reversible. Don't assume over-the-counter means safe, and don't assume aging is the only factor behind memory loss. So, what medications are you or your loved ones taking right now? Have you noticed mental fog or forgetfulness? Share in the comments. This might be the wake-up call someone desperately needs.